Good morning, everyone. Thank you for joining this morning's press conference. I'd like to introduce Mike Schreiner, leader of the Ontario Greens.
Thank you, Darren. Bonjour tout le monde. Good morning, everyone. Thank you for joining us today. And before I begin, I'd like to acknowledge that I'm speaking from my home here in Guelph on the ancestral lands of the Adirondack, the Haudenosaunee, the Anishinaabe, and the Ojibwe Chippewa peoples. And I'm located on the Treaty 3 lands of the Mississaugas of the Credit First Nation. And I just want to reaffirm the Ontario Green Party's commitment to combating colonialism, systemic racism, and to fulfilling the calls to action from the Truth and Reconciliation Commission. I really sincerely want to thank Jackie Walker from SEIU for joining me today to talk about this critically important issue. And that issue is that Ontario is facing a nursing shortage crisis as it battles the fourth wave of COVID-19. According to the Ontario Nurses Association, Ontario hospitals currently face an 18 to 20% vacancy rate for nursing positions. The staffing shortage is putting tremendous pressure on our healthcare system, especially frontline staff, and it's putting patients at risk. And Ontario must act now to ensure that there is enough staff to care for patients without the risk of staff burnout. The staff shortage is being driven by harsh working conditions and low pay. And this is unacceptable and it's fixable. Nurses are the heart and soul of our healthcare system and the backbone of Ontario's COVID-19 response. Many are burned out, stressed, and overworked after the past 18 months, and it's driving them away from the profession. According to RNAO, 17% of nurses say they are very likely or likely to leave the profession. We cannot, as a province, stand by and watch nurses suffer. They need our help, they need our support, and the province needs to step up and do the right thing. Premier Ford needs to do everything in his power to improve the working conditions for nurses and address these staffing shortages immediately. This morning, I sent the Premier an open letter calling on Doug Ford to do the following things. Repeal Bill 124 and give all nurses the pay raise they deserve. Implement a program to pay all nurses an additional $5 per hour if they are working on a short-staffed unit or department. To provide N95 respirators for all nurses to protect them from airborne transmission from COVID-19. To make pandemic pay permanent for all nurses, PSWs, and healthcare staff. To provide guaranteed access to mental health services for all nurses. To bolster admissions to nursing baccalaureate programs by 10% each of the next 4 years and increase the supply of nurse practitioners by over 50% by 2030. Finally, to streamline and expedite the lengthy process of granting nursing licenses to qualified internationally educated nurses through the College of Nurses of Ontario. I want to close by saying to the Premier, enough is enough. The Premier must step up and treat nurses with the respect and dignity they deserve. What does it say about us as a province if we can't even protect the nurses that are there to protect and care for us and our loved ones? So Premier, it's about retention and it's about recruitment. It's about investing in better working conditions and pay for nurses that will help address the current public health crisis that we face and prepare Ontario's healthcare system moving forward. Now it's my great honor to welcome and introduce Jackie Walker, who's a trained RPN in the current SEIU Nursing Division President. Thank you, Jackie, and welcome.
Good morning, Mike. Thank you for having me this morning. As Mike said, my name is Jackie Walker, and I am a proud registered practical nurse and president of Nursing Division at SEIU Healthcare. As a frontline RPN myself at a time, and now Nursing Division President, I know firsthand what nurses are feeling in this moment. Mike said it, we've got a human resources crisis in Ontario and in our healthcare system. It's the fact that nurses are burnt out. They are understaffed, they are underpaid and undervalued. And really, the province has failed to address this health human resources crisis. And that means patient care in hospitals and long-term care is at risk. The nurses know it, and they are saying this every single day. At SEIU Healthcare, we've called on Doug Ford to make pandemic pay permanent for all nurses and to introduce a universal minimum wage for RPNs of at least $35 per hour. We've also called on Premier Ford to kill Bill 124 so that workers can bargain for the supports that Mike mentioned, like psychological supports that they will so desperately need after this pandemic and right now. These actions are about bringing the financial and emotional relief to healthcare workers that are on the brink of breakout and the brink of walking away. I can tell you that thousands of nurses are literally on the brink of this today. So how can the public reasonably expect us to resolve the backlog of hospital surgeries and in a timely way when so many nurses are working short? This is something that I don't think we have an answer to, or that the Premier has an answer to. And my answer is that we can't. How can the public trust that nurses won't make mistakes despite of their best efforts? We are human. And when we've been run into the ground, you can expect this to happen. The answer to that is we can't. How can families, the moms, the parents of the frail seniors and the children of frail seniors in long-term care homes get the nursing care they need when RPNs are denied full-time work and decent wages? 19 months into this pandemic, I still hear stories that, keep me up at night and break my heart from nurses, RPNs who cry in their car before they go into work. Nurses who sit in their driveways and cry before they go into their homes so that they can put on a brave face to their family and say, "Mommy's okay." This is the reality of so many nurses who are also doing this, working 3 to 11 and not being able to put their kids to bed. I hear from career nurses who have worked in healthcare for over 30 years as RPN, registered practical nurses, who tell me that the morale has never been this low, not even during the Mike Harris days. And that's why it means so much today for me to be here with you, Mike, to champion your calls to action. Nurses appreciate the support. We appreciate what you are doing. And we hope that the Ford government responds to your letter and acts in the right way. Thank you for listening to me, and thank you for having me today.
Thank you, Jackie. We're now available to take questions from the media.
Thank you, Mike and Jackie, so much. So for the media Q&A portion, we'll use the raised hand feature, as I see some of you have already got ahead of. Please remain muted until I call on you. We'll do to start one question and one follow-up, and if we have time, we can loop back. So to start off, we have Brian Lilly. Brian Lilly, please go ahead and unmute yourself and ask away.
Hi, Brian. Thanks for the time today. I'd like to hear first from Jackie and then from you, Mike, on this. We're looking at what's happening in the United States right now, where they've started either suspending or firing healthcare workers who are not fully vaccinated. And it's caused a staffing shortage. It's causing a problem in terms of access to care. And I'm wondering your thoughts on that. It's not a lot of people within the healthcare sector, nurses or otherwise, but are you concerned that these measures, understandable they may be, will cause a shortage of care, cancellation of surgeries, and so on in the coming weeks and months.
You want to go first, Jackie, and then I'll respond. Thank you,
Sure.
Brian.
Sure. Thanks for your question, Brian. So at SEIU Healthcare, we've surveyed our members, and the vast majority of RPNs support the mandatory vaccines. For them, it's about being protected. And it's about knowing that the folks that they're working with side by side are protected and that they're safe. So over 90% of our members are vaccinated. Some people might quit. And that's why we need a recruitment and retention plan. That's why Mike's putting this plan forward. And Doug Ford simply does not have a plan, and he's passing the buck. So this is a provincial healthcare system. And in Ontario, that's what we have. Not a regional healthcare system, not a Princess Margaret healthcare system or a Thunder Bay regional healthcare system. It's provincial. And Ford is acting like every employer is independent, but we know that they don't act independently. In the hospital sector, for example, the Ontario Hospital Association negotiates for most hospitals in Ontario. And right now, they are putting up big blocks to us having health and safety policies, health and safety contract language that's going to protect workers and make sure that they are safe and that they have access to things like N95. So yes, this could put more pressure on our healthcare system. And that's why we need a strong recruitment and retention plan for the nurses and healthcare workers who are on the front lines right now. Many RPNs have multiple jobs due to a lack of full-time work, and the conflicting policies across different workplaces is causing confusion. The government needs to have one policy to ensure that the entire province is functioning the same. And the provincial government needs to take leadership on this.
Yeah, thanks for your question, Brian. I'd just like to echo Jackie's point about mandatory vaccinations for healthcare workers. The vast majority, well in the high 90% of nurses are vaccinated, and there's strong support among all the nursing associations for vaccine mandates. In my conversations with both frontline nurses as well as administrative staff and unions representing and associations representing nurses, is that the biggest challenge is working conditions and pay. And in some cases, I've talked to administration staff who want to negotiate contracts above the 1% cap that is in Bill 124, but they're not able to because of that legislation. And so one of the reasons I've been calling for the Premier to repeal Bill 124 is to enable negotiations to take place in a way that provides fair wages and better working conditions for nurses, because I think that is vital to any retention strategy. And then on top of that, to make the investments needed for a recruitment strategy so that we both retain our existing healthcare staff, we recruit and bring in additional staff, because of the backlog of canceled surgeries and canceled care during COVID is going to take significant resources in order to clear that backlog. And one of the biggest barriers is a staffing shortage of nurses.
Okay,
Follow up.
I hear both of you, but Jackie, if we lose between 5 and 10% of nursing staff, are we going to be facing a situation like we saw during the second and third wave, where surgeries were canceled, where people can't access care because there simply isn't the staff there? It may be a small amount, but if you take away 5 to 10% of the staff, what does that do to a system that you're saying is already facing a staffing shortage? We're already short. You take away another 5 to 10%. Are people going to be losing their access to cancer treatment, to hip replacement, to all of the things that are described as elective surgeries? But you and I know elective surgery is just anything that doesn't have to be done immediately to save a life.
Yeah, Brian, 5 to 10% of staff shortages and losses is going to have an even greater impact on our system. You know it, we're already in a crisis. And I believe that there are 5 to 10% of registered practical nurses right now who are considering early retirement, who are considering giving up their nursing license because of the Ford's temporary pandemic pay for PSWs, where they know they can move to a different area of the province and be compensated with less responsibility and risk to their license because of the poor working conditions. So yes, the people of Ontario should expect, not just because of mandatory vaccines, but because of the horrible working conditions and because of the lack of respect given to registered practical nurses, nurses and healthcare workers across the province from Premier Ford, and by way of some employers who say they can't negotiate fair wages because of Bill 124. Yes, the province of Ontario should be very concerned about everything that falls in the bucket of elective surgery, which we know are life-saving treatments, which we know are things that help the people of Ontario live a healthy and productive life every single day. I'm very concerned, the nurses are very concerned, and the people of Ontario should be very concerned.
Yeah, Brian, if you don't mind, I'd just like to add to that, that the one thing you and I absolutely agree on is that I would say the notion of elective surgeries is misnamed. Most of those surgeries are essential and vital to people's care. If you look at the data in the survey data, far more nurses are leaving the profession or considering leaving the profession because of burnout, being overworked and underpaid and underappreciated. And so the best steps the province can take in terms of retention is providing better working conditions and fair wages.
Thank you. Next up, we have Adam Donaldson. Adam, unmute yourself, please, and go ahead.
Thank you. Good morning. I have a kind of a practical question and a kind of political question, but I'll address my practical question to Jackie first. You know, part of your job is advocacy and reaching out to, you know, different people in the government. I guess, what kind of signs are you looking for from the government to show that they're kind of addressing your concerns? And, you know, why is it like kind of 16 months or 18 months into this, we're still kind of struggling to hear nurses and the people you represent, despite everything that's happened so far?
Yeah, a clear sign, Adam, that the government is serious about respecting, protecting, and paying nurses appropriately would be one, to kill Bill 124. Give them the ability to negotiate for psychological supports, for the physical supports, for the backbreaking work that they have done for the past 18 months, and even before the pandemic started. This was an issue. Next, I would say implement pandemic pay for all healthcare workers. This is crucial and this is vital. As a union, we're advocating for a universal wage of $35 for registered practical nurses. This would be an indicator that the government actually acknowledges their knowledge, skill, and judgment and would be paying them appropriately. You know, one nurse that I spoke to who's been an RPN for more than 30 years said the morale has never been this low. And other than the excessive workloads, which 94% of RPNs say they experience excessive workloads from being short-staffed, and those short-staffed situations lead to an insufficient quality of care that RPNs don't believe meet the CNO standards. The morale really needs to be addressed. And another piece of Mike's platform that I am grateful that he's championing is providing nurses and healthcare workers with access to N95 or better respirators in the event that they're experiencing or working with any airborne diseases. This is crucial. You know, we don't expect firefighters to run into a burning building without a hose. We don't expect police to show up to you know, a house without a you know, what is that called? A bulletproof vest. But we expect nurses to walk into rooms where nurses and other healthcare workers to provide care for people who are suspected COVID-19 positive and other respiratory illnesses without the protection that they determine is appropriate. And this is a shame. Lastly, I would say the psychological supports. If the government would repeal Bill 124, they wouldn't put it in the nurses' hands to decide, do I want a 1% wage increase, or do I want to have access to coaching and debriefing after a violent incident, or after I've worked 18, 19, however many months this pandemic is going to continue, and not have the supports that I need to make sure that my mental health is in check. We surveyed nurses, and their mental health is not good. 94% of RPNs said they've experienced mental exhaustion. 90% experience high levels of stress. 87% are feeling physical exhaustion, including upper back pain and lower back pain. If the government is serious, if Doug Ford is serious about showing Ontario, not just the nurses, but Ontario, that he cares about a public health system that supports the people of Ontario, he will take care of his nurses. And if he doesn't, that should be a clear signal to all of Ontario that he's not really there for the people.
Great. And my political question goes to you, Mike. The legislature comes back next week. There's school, there's hospitals, there's, things that need to be amended or fixed with the vaccine mandate. I mean, what kind of political landscape are you and the other legislators walking into next week with, a dozen different competing like #1 demands?
Yeah, Adam. So, first of all, I don't think the legislature should have been delayed restarting. We should have been meeting over the last couple of weeks because of the exact issues you're talking about. I think obviously a top priority, and I'm assuming this is going to be for all the parties, is what's the best strategy to addressing the fourth wave of the pandemic. And if you carefully read the letter I wrote the Premier today outlining what I think we need to do to address the nursing shortage challenge, I didn't write it in like hyper-partisan language or in a way that, just spent all my time criticizing the government. I just put forward concrete actions that I think the government can take to address the crisis we're facing right now in our healthcare system due to the shortage of nurses that I think are only going to get worse if we don't bring in the measures that Jackie has so eloquently outlined. And so, I'm ready. I always say I'm ready to work across party lines to really address the pandemic. And so addressing the staffing shortages in healthcare is critically important. I think making sure our schools are safe is important. I've been advocating for a long time for lower class sizes, better ventilation, and rapid testing in schools. The fact that parents now are having to organize, groups to try to bring in rapid testing to help identify and contain the spread of COVID in schools, I think it's just unacceptable. When we're in the fourth wave of the pandemic. The government just needs to step up and provide some of those basic needs and services. And then businesses, I've had so many small businesses reach out to me with deep concerns around the way in which the government's rolling out the vaccine certificate program. Most of them have said to me, we support the idea. We want to do everything possible to avoid a fourth wave lockdown. We don't want to see schools closed. And so I think the government has to clarify and answer some of the questions small businesses have around, whether they're legal obligations. How is enforcement really going to work? And will the government provide some additional financial supports to small businesses to help them train staff and make sure they have the equipment, especially when the QR codes come in October, to be able to implement the strategy in a way that works for small businesses that are already under huge financial and human resource stress. And so those are going to be some of the top priorities for me next week. And as always, I'm willing to work with the government and the other opposition parties to make sure we have a coordinated response to the pandemic.